Remove the protective guard. Advance and retract the spring wire guide to ensure proper function. Remember to begin the insertion with the wire fully retracted. If the wire is not fully retracted, it will act as an obturator in the needle and blood return will be hindered. Slowly puncture the vessel. Look for flashback in the flash chamber just behind the needle protection cap. Stabilize the needle position and advance the spring wire guide. When the handle reaches the black mark on the feed tube, the tip of the wire has reached the needle bevel. If you meet resistance at this time, the wire can be safely retracted and better positioning can be attempted. After advancing the wire and encountering no resistance, advance the entire unit 1 to 2 millimeters to ensure the catheter tip has entered the vessel. It is possible to see a blood return without the catheter being fully in the vessel because the needle bevel may be in the vessel and the catheter tip, which is located just behind the needle bevel, may not have fully entered the vessel lumen. While holding the introducer needle hub, the clear hub that covers the red safety hub, advance the catheter over the spring wire guide. As the catheter advances, the red needle protection cap will follow and will remain locked onto the catheter hub until the needle enters the protection device. Secure the catheter hub and continue to pull the needle hub. The needle tip will be locked into the protective assembly when the needle is pulled out of the catheter hub. As soon as the needle is protected, the red cap can be separated from the catheter hub. A small amount of resistance can be felt as the safety device separates from the catheter hub. Therefore, you should adjust your grip on the catheter to prevent the catheter from pulling out of the insertion site. Verify the arterial placement by observing the pulsatile blood flow, or in cases of low flow, verify by the monitored waveform. If there is no flow from the catheter, you will need a wire to re-establish vascular access. This product is designed so the integral guide wire can be removed from the needle and feed tube by pulling up on the wire handle. Withdraw the wire gently to avoid blood splatter. Examine the wire for any damage after pulling back through the needle. If the wire is frayed, a new wire or new device must be used. Attach the components you will be using, such as the stopcock, injection cap, or pressure tubing. Secure the catheter to the patient. This program shows the use of a catheter securement device made by Venitec International. The use of this or other safety devices further reduces the risk of needle stick injury by eliminating the use of sutures. Dress the insertion site according to your hospital's protocol, and finally dispose of all sharps in accordance with OSHA regulations.